such programs became more challenging. So what if these problems persist until the year 2050? Drug abuse is often accompanied by a devastating social impact upon community life. The negative consequences of drug abuse not only affect drug-dependent individuals but also their families and friends, various businesses, and government resources. Economically, drug abuse by an individual manifests itself in prevention and treatment costs, healthcare and hospital costs, increased morbidity, and mortality. Beyond this, people under the influence of drug abuse pose major safety risks and costs to people around them and the environment. In addition, crime committed under the influence of drugs is a major problem worldwide, with news reports of drug-related crimes not being new to us, especially here in the Philippines. Another is the impact of substance abuse on an individual's productivity. Studies have put the costs of lost productivity borne by employers at tens of billions of dollars. Imagine a poverty-stricken Quezon City plagued by various problems related to education, health, and peace and security. So how do we turn this all around? Be a little strange for some, but definitely achievable. We know that drug abuse is a multi-sectoral issue, therefore there is a need to identify the key factors in order to lay down policy solutions and recommendations that recognize the need for more inclusive, humane, and sustainable programs, projects, and policies that are beneficial for the community. Through the interviews and brown bag discussion that our team conducted with various stakeholders, envisioning a safer, healthier, and drug-free Quezon City community can now be a reality. Imagine a Quezon City where each and every citizen is given immediate support for their physical, social, and mental health. There are continuous and long-term programs for health assessment as well as mandatory illegal substance use tests in order to ensure that the health inequalities are addressed as well as combating the use of illegal substances. All programs related to health and social welfare are individualized to meet the varying needs of every citizen and address the gaps of inequality. Early prevention and intervention measures are at play when it comes to preventing substance use and abuse. Such programs are people-centered where the focus is to save lives and their futures. From the high-rise metropolitans to the local community centers, people are educated about the implications of substance use and are empowered to promote constructive lifestyle and norms that discourage all forms of illegal substance use. Quezon City's treatment and rehabilitation for drug dependence is at its best, where the best principles and practices are at the forefront of health and social welfare programs. The youth of Quezon City takes charge of the community-based initiatives on developing and implementing strategies to influence their generation to choose a safe and healthy lifestyle away and without the use of illegal substances. There is a great dynamic and powerful linkage in terms of institutionalizing policy frameworks and structures with key stakeholders such as the academe, non-government organizations, national government head agencies, and community-led entities who are part of a larger goal of destigmatizing substance abuse. Imagine a community where all Quezon City citizens are able to live in a healthy community composed of resilient, adaptive, and vision-oriented people. Imagine a community where all Quezon City citizens are able to live in a safe, healthy, and drug-free community that is sustainable, adequate, and people-centered. As Filipinos, it is included in our responsibility to contribute in building a better nation. There sure are challenges and obstacles present today and in the future, but together, working towards a healthier and drug-free Philippines is possible.